All right, we're starting on part C of the muscle anatomy. Did I speak with you guys before I think about this? I think I got this recorded yesterday on Integrity for the anyway, the last time I recorded, I think I got this recorded. But did you and I talk about how I want your coloring books turned in and how I want the stuff to be shown? Okay, let me tell you really quickly, and it'll be recorded twice, and oh well, that won't be the end of the world. I don't know if anybody has a coloring book handy, but let's just pretend that I do. Oh, you got one handy. Yay, let me steal it. I'll give it right back. All right. In fact, I'm not going to bother to catch this on camera because I can describe it, and you'll see some stuff on screen anyway. The white screen that the Integrity people see on there, just pretend for a minute that you're looking at the front of your coloring book, and you open that first cover to the cover page. Here on the inside of the front cover, we got just a big solid white page. What I'd like you to do is to take your pen and draw a line vertically down the middle of that front page, sort of like this. And the reason for that is you and I are going to use this coloring book for 2 semesters, right? A&P1 and A&P2. And what I want you to do is completely ignore the right side of this page, so don't do anything over here now, which is closest to the title page. Instead, out on the edge, what I want you to do is tell me which pages you colored. And the reason that I want that is to make grading a little bit easier. So just right at the top of it, A&P1, Fall 11. Maybe a little line under that for emphasis, don't really care. But what I want you to do in the space below here is tell me which pages you colored. Maybe you did page 1 through 15, and then you got lazy, so you skipped a few, and then you got back around and picked up a few at maybe 37 through, 45. Remember, you're doing 1 through 69 is what you have available. And then maybe you did 60, and then maybe you did 65 to 69. And that actually is not unusual for a book that gets turned into me. So I want to know which pages you did, and then probably most important of all, at the bottom of this, write the word total equals, and then a little blank, and then tell me how many pages you did. And I'm not going to bother to count those, and frankly, this is just a wild damn guess. Let's say that's 45 pages. And what I'll do then is while you're taking your final, I'll be sitting up here at the front table, and I'll flip through there, and I'll just open the front page, and I'll divide the total number of pages by 4, because you've got to do 4 pages to get a point right, and then I'll record those on D2L. Now, this looks like an easy way to scam me, because you could say, well, if you're not going to even look at them, I'm just going to tell you I did them all. Well, I will randomly, and you won't know whether I pick your book or not, flip through and check. In fact, I'll usually thumb through most of them and see if you did roughly what you said you did. And assuming you did what you tell me you did, you're going to get all your points. If you try to scam me, maybe you color 3 pages, 1 in the front, 1 in the back, and 1 kind of in the middle, and tell me you did them all, guess what I'm going to do? You're going to get 0 points. So don't lie to me. Just tell me how many pages you did. It'll make the grading very quick and easy. So on test day, if you're taking the test, what you need to do then is to bring me your test paper, show me your clickers turned off, and then take your book, because it'll be ready. Another easy, quick trick, because all of these coloring books look alike, and I watch every semester at the end of the semester, I watch people opening pages. Is this one mine? Opening the next one. Is this one mine? They all look alike. First of all, make sure your name is in the damn thing, because they all look alike. And second, maybe not on the inside pages, but on the edge of the book, the edges of the pages, write your name there. That way it's really easy to find your own book, and you don't have to do a lot of flipping through. Another really handy trick to kind of stop that business of maybe people tearing out the first page and writing their name on the next page is on a lot of my books, since I was like 6 years old, I learned a trick and a habit from my grandmother. I'll pick a particular page or 3 inside the book, and I'll put my initials really, really small on the inside crease of the fold, so they're hard to see unless you know me and know which pages I pick. I know which pages I pick, but I'm not telling you. Say maybe page 63, you've got your initials on the inside. And that way, if somebody happens to take your book and try to say it's their work, you can say, well, let's just flip over to see if anybody's initials are in there. See, that's mine. So it's a handy little trick if you want to use it, yay. And the reason you're keeping this inside blank is we'll use that at the end of A&P2. Make sense? Yes? It's points. Any point you get is just points. So points come in, and actually mastering is a little bit differently than that, so I shouldn't say that. Any points you get on a test, anything you get for the extra credit, like the Get Ready thing we did at the beginning, are just points. And they'll get all added together and then averaged in, yes.
Same for the Get Ready. Great.
Same for the Get Ready. I think I gave you guys 5 points on that. They haven't been added yet, but they'll come in next week. The mastering stuff will end up going online after next Friday. The last 2 assignments, there is a end of Chapter 10 test. They call those things chapter tests. You know they're not really tests, right? It's just a big quiz at the end of the chapter. And then there is a drag and drop labeled the muscles exercise that'll probably wake up in the middle of the day today. And those last 2 are due next Friday. So I'm not going to figure the grades on mastering until after next Friday, because some people are going to wait till the last damn minute. Now, you might sit here and think, well, I'm going to do mine as soon as they're available. I'll have it done before this Friday. So would you please post mine on D2L? No, I'm not going to do that, because I don't want to do 3 here and then 7 on Sunday when somebody else is done, and then about 50 on next Friday when everybody's done. I'll wait until the assignment dates are done and it's not possible to do any more work, and I'll do them all at once. It's easier for me to just kind of do them all at one time. When you log into mastering, I think it shows you this ratio, and I'm going to make numbers up because I'm not sure how many points there are. If it says, say for instance, there are 206 available points and you have 187 of those, you see that whenever you log into mastering?
Yeah.
Okay. Do you know how to figure out what your grade is based on that? Divide that, and it'll give you like 0.67 or something like that. That's a 67. No, hopefully I think most of you are way better than that, but that's how you figure this. If you want to make the decision for yourself of do I take the final or do I not, look at the grades of all of your tests that are already on Desire to Learn, throw away the lowest one, or frankly, if you want to skip the final, don't throw away any of them. Add in that mastering grade and divide it by 5, and that's going to be your grade. So make your own call whether you want to take the final or not. If you're happy with your grades up till now, then okay. Fair enough? I've gotten a couple of emails of when exactly is the coloring book due. It's due the day you take your final. If you want to turn it in earlier than that, that's fine, but it's due on the day you take your final. I will not take them after your final. So just understand that. If you don't have it turned in by then, be sure you bring it the day you take your final. Because the very next day, I'm flying to Colorado. And I'm not coming back to grade your coloring book. Yes, ma'am. I'm not, no, well, if you turn them in early, I'll do my best to get it graded and back to you, but I probably will have a big stack and I'll grade them all the day of the final. But if you're not going to be with me for AMP2, then you can get it back. Just tell me and I'll get it back to you right away. The best scenario is get it the day you take the final. You can, if you're going to be with me for AMP2, you can get it in early January, but the danger with that is I've had instances where people at the day of the final pick up the wrong book, whether it's an accident or just for spite they pick up somebody else's book. And I'm not going to sit here like the security at the airport saying, show me your ID and let me see whose book you have. I'm not going to do that. So if you choose to leave it and get it in January, that's your risk and your choice. I'm not going to be liable for making sure you get a coloring book back if you don't get yours that day. Does that make sense? Okay, fair enough. Let's get on with Part C of Chapter 10. We're looking mostly today at shoulder and arm muscles. We're going to start off with muscles that actually cross over the shoulder joint and insert somewhere on the humerus to move the upper part of the arm. These originate, bless you, these originate on the scapula, and some of them originate on the axial skeleton. And the 3 that are involved in moving the arm around, the prime movers of the arm, are pectoralis major, latissimus dorsi, and the deltoid. The actions that these do are flex, extend, adduct, abduct, and rotate the humerus. So all 3 of these move the humerus. I'm going to wake up the webcam because I forgot to do that, and we need to look at some models today, so forgive me while I jump over and get that thing awake. Where did it go? Oh, there it is. It just wanted to hide from me. Okay. Let's get y'all cam awake. By the way, I don't know if you know about that thing or not. You've watched me use this all semester long. If you've never had the opportunity to use it, YAWCAM is the YAWCAM is a freeware, actually a donationware kind of thing, and it just opens up a big window that you can resize to make it however big you want, and it reads whatever webcam you've got hooked up to your computer. So if you have any need for something like that, that's what I've been using all semester long, and it's donationware. Pay the guy who built it, and you can get some nice stuff. So, okay, pectoralis major, latissimus dorsi, and deltoid all show up pretty nicely on our Pink Lady model and the little arm. So let me take you over and show you, actually pectoralis shows up better on Tommy. Let me take you over and show you these on our camera. Let's get this camera here, and I'll show you on this lady. We always end up looking at Pink Lady's bottom. Latissimus dorsi, pectoralis major, and deltoid. You know what? Actually, I'm going to show you these on 3 separate models. Latissimus dorsi is this belt right here. It comes up and attaches on the humerus, kind of under the arm, and it comes around as this big wide belt and attaches here in the low back, sort of in this area right here. Actually, sort of. You'll know the actual origin later on. Now, on Tommy's chest plate, forgive my audio here, we have on Tommy's left side a pectoralis major. It's been peeled away on the right side so you can see the pectoralis minor, but on Tommy's left, pec major shows up really, really well. On the arm model, which is probably the best place to see this muscle, we have a deltoid, and this is the big meaty part of your shoulder right here. So these are the 3 muscles that are the prime movers of the humerus. And they move in all sorts of interesting ways, which we're about to take a look at, including flex, extend, adduct, abduct, rotate, and off we go to the next page. So these 3 kind of in turn, and this is why the sound is weird here. So for the people in the room, you won't hear it quite as well, but on Integrity, it'll get recorded really nicely.
The pectoralis major is the large superficial muscle of the arm located in the anterior thorax. It may be separated into 2 groups of fibers, superior or clavicular and inferior or sternocostal. The origin of the superior or clavicular fibers is from the anterior surface of the medial 1/2 of the clavicle. The insertion is to the lateral lip of the intertubercular groove of the humerus. The origins of the inferior or sternocostal fibers are from the anterior surface of the sternum, the costal cartilages of ribs 1 through 7, and the aponeurosis of the external oblique muscle. The insertion is to the lateral lip of the intertubercular groove of the humerus. Acting as a whole, the key actions of the pectoralis major are medial rotation and adduction of the arm. Medial rotation is a movement during which the anterior surface of the arm turns toward midline. Adduction is a movement in a medial direction toward the mid-sagittal plane. The pectoralis major also assists in extending the arm at the shoulder from a flexed position. The pectoralis major is the large superficial muscle of the arm located in the anterior thorax. It may be separated into 2 groups of fibers, superior or clavicular.
We got repeat on these, so if you catch one of them repeating and I'm not paying attention, stop me. Okay, latissimus is next.
The latissimus dorsi is the large triangular-shaped muscle of the upper limb, which has an extensive origin from the posterior thorax and abdomen. The origins of the latissimus dorsi are from the posterior lip of the iliac crest, the spinous processes of vertebrae L5 through T7, and ribs 8 through 12 via the thoracolumbar fascia. The insertion is to the intertubercular groove of the humerus. Latissimus dorsi extends the arm at the shoulder. From a state of flexion, it moves the arm to an anatomical position or to a state of extension, and beyond this to a state of hyperextension. It also adducts the arm by moving it in a medial direction toward the midsagittal plane, and medially rotates the arm by turning the anterior surface of the arm toward midline. Latissimus dorsi is innervated by the
And I'll usually stop these after they start talking innervation. Keep in mind, I think I told you guys this the other day. I'm mostly concerned, I told you the best way to study these is name of the muscle and its rough description. And after you do the name and description, then OIA, origin, insertion, action. We had that talk the other day, right? And the last item that's usually learned there is innervation. And I told you the other day, and I'll just reinforce it now, the main muscles that I want you to be learning the nerves on are from basically the neck up. So easy stuff like the facial nerve controls all that move the face. So whenever we're down here below the shoulders, I'm not going to worry about the innervation, and I'll usually stop that at that point. The last in this list is the deltoid, so let's play that.
The deltoid is the large fleshy muscle we most associate with the shoulder complex. It may be separated into 3 groups of fibers: anterior, middle, and posterior. The origin of the anterior fibers is from the lateral 1/3 of the clavicle. The insertion is to the deltoid tuberosity of the humerus. The anterior fibers move the arm forward from anatomical position, thus flexing the arm at the shoulder. They also medially rotate the arm by turning the anterior surface of the arm toward midline. They are innervated by the axillary nerve. The origin of the middle fibers is from the acromion of the scapula. The insertion is to the deltoid tuberosity of the humerus. The middle fibers abduct the arm. They are innervated by the axillary nerve. The origin of the posterior fibers is from the inferior border of the spine of the scapula. The insertion is to the deltoid tuberosity of the humerus. The posterior fibers extend the arm at the shoulder. And laterally rotate the arm by turning the anterior surface of the arm away from midline. They are innervated by the axillary.
And we'll stop that. Okay, next is kind of a famous group of muscles. These are often discussed by people who are injured in, say, an athletic way or some sort of outdoor injury or, frankly, any sort of injury that involves a group of muscles known as rotator cuff. And the general public, I'll tell you now, has the idea that the rotator cuff is some this mysterious thing in your shoulder. Some people have the idea that it is a muscle. Some have really no idea what in the hell a rotator cuff is, but it's 4 muscles all working together to kind of wrap around that shoulder joint and enclose it. And the 4 muscles involved here are supraspinatus, infraspinatus, teres minor, and subscapularis. And they all show up beautifully on our arm model. And I'll show those to you here in just a minute. In fact, you know what? Let's jump to the camera and I'll show them to you right now. What does the word supra mean? And infra means below. So the supraspinatus and infraspinatus are above and below the spine of the scapula. Subscapularis is actually on the underside, closest to the body wall of the scapula. And then teres minor I'll just have to show you. So let's jump over to our little arm model. And I want to show you all of these. All right, here on the, let me get the deltoid out of the way because it's kind of right in our face right here. You can see the spine on the scapula. Above the spine, what do you think we got? Supraspinatus. Below the spine, infraspinatus. Now, here are 2 other little muscles. The one on the top is part of the rotator cuff, and it is teres minor. The one on the bottom, not part of rotator cuff, is teres major. It's a really easy one to confuse. On the inside of the scapula, here, we have the subscapularis. So subscapularis, supraspinatus, infraspinatus, and teres minor are all part of the rotator cuff. The teres major down here is not. And that's one that sometimes makes its way into a favorite test question of mine that asks, hey, here's 5 muscles. Which of these belong to the rotator cuff? And the one that people often get tripped up on because, there is a supraspinatus and an infraspinatus. They sound like a really cool pair. One above the spine, one below the spine. Teres minor and teres major kind of sound like they go together, and they sort of do, but they're not both part of the rotator cuff. Subscapularis is the other one that is included. So be careful if that question comes up, and it's actually the clicker question. Let's see how many of you get it right here in just a minute. What the rotator cuff does is it reinforces the capsule of the shoulder. They act as synergists and fixators. In other words, none of these four are the prime movers at the shoulder joint, but they help the motions, which is what synergists do, and they can lock parts of the shoulder at various times, which is what fixators do. Two other muscles that are synergist here, in other words, helping the movement of the shoulder, are coracobrachialis, and hey, there's the other weird one, teres major. So let's take a look at these muscles that cross over that joint between the glenoid fossa and the humerus. Here we go.
There are 9 muscles that cross the shoulder joint and act on the humerus. Of these 9 muscles, only 3, the latissimus dorsi, the pectoralis major, and the deltoid muscles are considered prime movers of the shoulder joint. The other 6 muscles play a synergistic role in movement, but their primary role is to stabilize the shoulder joint. 4 of these, the supraspinatus, infraspinatus, teres minor, and the subscapularis, are grouped as the rotator cuff muscles and are discussed separately. The remaining 2 muscles are the teres major and the coracobrachialis. The muscle origins and insertions in relation to the glenohumeral joint are best introduced as anterior and posterior muscles that originate off of the scapula, and anterior and posterior muscles that originate off the axial skeleton.
Next, we have movement from rotator cuff in 2 separate videos.
The rotator cuff is a term used to describe the group of muscles and tendons that stabilize and reinforce the glenohumeral joint and assist with the angular and rotational movement of the humerus. All 4
See why they call it a cuff? It just kind of wraps around the head of the humerus and sucks it into the shoulder.
muscles combine at the humeral head by way of tendons and form a cuff over the joint, hence the name rotator cuff.
And then here's the weird one that's not part of the rotator cuff. This is the teres major.
The origin of teres major is from the posterior surface of the inferior angle and lower 1/3 of the lateral border of the scapula. The fibers run superiorly and laterally to insert onto the medial lip of the intertubercular groove of the humerus. Teres major adducts the arm, medially rotates the arm, and extends the arm. It is innervated by the lower subscapular.
I want to pause on the innervation. The picture that you see here is really good evidence why it's not part of the rotator cuff. Those 4 rotator cuff muscles were right around the head of the humerus. Where is this one inserting? Lower down. It's actually on the edge of the intertubercular groove. So it's not part of those that wrap around the head of the humerus, and that's why it's not part of the rotator cuff. Next. Hey, here we go. This is your one and only clicker question of the day. I gave you the answer already, so Lord help you if you miss this one. Kind of a freebie. I'm here and I'm smart. Give me your answer. I want you to click the ones that do properly belong. So you're giving me 4 letters here. There's 4 muscles in the rotator cuff. Which ones actually do belong in this group? And if you're watching this on Tegrity, obviously you're not clicking in on a video. It's not live and interactive. Still waiting on one more of you in this last 8 seconds. 16 of you are here. Where's the other person? Yay, gotcha. Is dead? Holy moly! I still get. Somebody said only C. Somebody said A, B, and C. A, B, D, and E. Subscapularis, we're good there. Teres minor, we're good there. Teres major is not, so don't click C. Infraspinatus and supraspinatus are the right ones. Now, for those of you who clicked C thinking, well, that's the one that's not, the question was which ones are. Okay, question? Sure. Action. What does it do when the muscle contracts? And that's actually where we're done with the clicker stuff. So if you want to put that clicker thing away, you're not going to hurt my feelings at all. Nothing else with the clickers today. Ow, that was loud. Oh, and it's going to get out of here. I hate when it does that. Let's keep on going. Yay, this is just a photo that shows a lot of the muscles we've talked about. We're going to add in here these three, and we're going to kind of move down the arm with biceps brachii, brachialis, and brachioradialis. These muscles are involved in moving the elbow. Hang on. Looks like we're still looking at rotator cuff stuff.
The anterior scapular muscles that cross the glenohumeral joint are the coracobrachialis, the biceps brachii, and the deltoid. The coracobrachialis muscle originates on the coracoid process of the scapula and inserts on the medial surface of the humeral shaft. The biceps brachii muscle has two parts, a long head and a short head. The short head originates on the coracoid process of the scapula, while the long head originates on the supraglenoid tubercle of the glenoid cavity. The two heads of the biceps come together distally and insert on the radial tuberosity, just distal to the elbow joint. The deltoid muscle is composed of three distinct sets of fibers. The anterior fibers, which originate from the anterior border and lateral third of the clavicle. The middle fibers, which originate on...
You know what, I'm going to stop that because we've already seen a demo of the deltoid, and we've seen what it does, so I'm going to let that go.
The anterior axial muscle that crosses the glenohumeral joint is the pectoralis major muscle. The pectoralis major muscle originates on the sternal end of the clavicle. The sternum and the costal cartilage of ribs 1 through 6. All the fibers converge on the lateral edge of the intertubercular sulcus of the humerus to form the insertion point.
We saw that on the Tommy chest. Next page. Oops, was not supposed to be a blank page. Here we're seeing a posterior view, and we are seeing a few muscles we've seen already, and at least one that we've not talked about yet. We are seeing several of the muscles of the rotator cuff, including supraspinatus here, infraspinatus here, teres minor, which is right here, and then the weird one that does not belong to the rotator cuff, teres major, which is that little strap right there. And we've kind of already done those. We've also done the latissimus dorsi, this big strap that goes from along the edge of the back to underneath the arm to attach on the inside of the humerus. And the one in this picture that we've really not done anything at all with is the triceps. The triceps brachii is named triceps because it actually has three heads. In this picture we see the lateral and the long head. We don't see the third head in this particular image. And the one little oddball that's in this picture, which I generally don't do a whole lot with, is the anconeus on the lateral edge of the elbow. So triceps is the new one in this picture that's of most concern. It looks like we have some more videos of rotator cuff function and scapular muscles. So hang tight.
The posterior scapular muscle that crosses the glenohumeral joint is the teres major muscle. The teres major muscle originates on the inferior angle of the scapula and inserts on the medial edge of the intertubercular sulcus of the humerus. The posterior axial muscle that acts on the glenohumeral joint is the latissimus dorsi muscle. The latissimus dorsi muscle originates on the spinous processes of vertebrae T7 through...
We've actually done that. I'm going to stop that one. All right, we've got a really good table that breaks down the actions of some of the muscles that we've taken a look at. They also include the abbreviations PM if it's a prime mover, and these are a nice listing that really would make a good study guide. So I'm not going to go over this, but I would say you may want to take a look at it. It's going to give you the breakdown of pectoralis, latissimus, teres major, deltoid, subscapular, supraspinatus, infraspinatus, teres minor. Those four there would be the rotator cuff series, and also coracobrachialis, biceps brachii, and triceps. So take a peek at those, and it tells you sort of what they do to the shoulder. So here we have the bulk of the muscles that are involved in moving the shoulder around. It looks like we still have a little bit more at the shoulder to do, though. We got an overview first.
Interactions of the 9 muscles that cross the glenohumeral joint are complex, and each muscle contributes to more than one movement. Additionally, movement at the glenohumeral joint can take place in all directions, where associated muscles can act as synergists in one type of movement and then antagonists in another type of movement. Therefore, 6 movements of the joint and humerus will be considered: flexion, extension, abduction, adduction, medial rotation, and lateral rotation. Flexion of the glenohumeral joint results from the contraction of 2 synergists, the coracobrachialis and the biceps brachii, and 2 prime movers, the anterior portion of the deltoid muscle and the clavicular fibers of the pectoralis major muscle. Extension of the joint results from contraction of 1 synergist, the teres major muscle, and 2 prime movers, the posterior portion of the deltoid muscle and the latissimus dorsi muscle.
One more and we're done on this page.
The deltoid muscle, mainly the middle portion, is the prime mover for abduction. However, alone it can only abduct the humerus to an angle of 90 degrees relative to the scapula before the greater tubercle of the humerus presses against the acromion process of the scapula. Further abduction requires that the head of the humerus and the glenoid cavity of the scapula be laterally rotated. Lateral rotation of the humerus is accomplished by 2 rotator cuff muscles, the teres minor and the infraspinatus, while the serratus anterior muscle laterally rotates the glenoid cavity. Adduction requires 2 prime movers, the pectoralis major muscle and the latissimus dorsi muscle, and 2 muscles that act as synergists, the teres major muscle and the coracobrachialis muscle. Medial rotation results from the contraction of the teres major muscle, the latissimus dorsi muscle, the subscapularis muscle as the prime mover, the pectoralis major muscle, and the deltoid muscle.
And we're done with that one. I think we got one more on this one.
The deltoid muscle, mainly the middle portion, is the prime mover for abduction. However, alone it can only abduct the humerus.
Oops, no, my bad. We saw that one. Sometimes I lose count on these multi-page videos. All right, anterior flexors. Biceps brachii, which you kind of probably thought is the main muscle of bending your elbow, isn't really. The brachialis is actually the prime mover there. So this one is a prime mover, and this one is a synergist. Synergist meaning it helps the movement. Brachioradiologist is a synergist and a stabilizer. And let's take a look at these 2 videos. First one. What in the heck? Oh, those are dead. You know what? I'm going to be okay with that. Let's just go on. Anterior view is going to show us a lot of the muscles we've been looking at. And here are a few more videos to take a peek at.
The forearm flexors consist of the brachialis, the brachioradialis, and the biceps brachii. The brachialis muscle originates on the front distal half of the humerus and inserts on the coronoid process of the ulna.
For the record, this is another favorite question of mine because a lot of people think the biceps brachii is the prime mover, and the one we're looking at now is the real prime mover here for elbow flexing. Brachialis.
The brachioradialis originates on the lateral supracondylar ridge of the humerus and inserts on the base of the styloid process of the radius. The biceps brachii has two parts, a long head and a short head. The short head originates on the coracoid process of the scapula, while the long head originates on the supraglenoid tubercle of the scapula. The two heads of the biceps come together distally to insert on the radial tuberosity, just distal to the elbow joint.
Biceps brachii is the large two-headed flexor muscle located in the anterior compartment of the arm. The origin of the long head is from the supraglenoid tubercle of the scapula. The origin of the short head is from the tip of the coracoid process of the scapula. The two heads insert by a common tendon onto the radial tuberosity and by the bicipital aponeurosis, which blends with the deep fascia on the medial aspect of the forearm. Biceps brachii flexes the forearm at the elbow supinates the forearm, and weakly flexes the shoulder. It is innervated by the muscular...
Don't care about the innervation. Here's the prime mover at that flexing.
The origin of brachialis is from the distal one-half of the anterior surface of the humerus and adjacent intermuscular septa. The insertion is to the tuberosity and coronoid process of the ulna. Brachialis flexes the forearm at the elbow. It is innervated by the musculocutaneous nerve and a small...
Don't care. Brachioradialis.
The origin of brachioradialis is from the lateral supracondylar ridge of the humerus. The insertion is to the base of the styloid process of the radius. Brachioradialis is an especially strong forearm flexor when the forearm is in a semi-pronated position. It is innervated by the deep radial nerve.
Let me show you several, probably all of those on our webcam real quick. On our arm model here on the light table. Boy, I didn't intend to jump out of that. Okay, we have a left arm coming on screen. I don't think anybody's really surprised at the fact that this is the biceps. I can't make the camera change its, bless you, change its magnification, so forgive that. This one's the biceps. I'm going to take the biceps out of the way. So that one, the two-headed biceps, which you're used to, is a synergist, which means it helps. It's not the main mover, although it does help. Underneath this, we've got the brachialis, which is the prime mover. So you've got to take the biceps off of here to see the brachialis. And it kind of comes underneath there. This one, get my finger over here, move this. This one is the brachioradialis. And if you look at this one on my arm, you can kind of partially, I'll tell you what, let's do my right arm, partially rotate medially, and this pin, oops, that's not showing you that at all, is it? I better move that up. Partially rotate medially, and this muscle right here that you can kind of pinch up there, just underneath your elbow, that is the brachioradialis. You can get hold of that one on yourself. You can get hold of the biceps on yourself. You can't get hold of the brachialis on yourself because it's underneath your biceps. So there you are, and that kind of helps if you feel those as you're going along. Posterior extensors include the triceps brachii. This is the large muscle on the back of your arm. And coneus, which is on the lateral part of the elbow. That's the weak synergist. It kind of weakly helps along. We can see both of those here. Mostly, get my pen back. Here's triceps. I'll show it to you on the little model. And then Anconius, I don't think it shows up really well on this model, and no, it doesn't. So Anconius is not one we'll be finding on the arm model, but the triceps we certainly can. And as I get the light table kind of rearranged a little bit, here's our arm model. The biceps has been pulled away, so let me put it back just for reference. Okay, there's a biceps. And on the other side, as I turn it around and you're looking at the rear, here's two heads of the tricep muscle, here and here. So that's triceps, and it's easy to find on our arm model. Here are a couple of muscles, a couple of movies involving those.
The forearm extensors consist of the Anconius and the triceps brachii. The Anconius originates on the lateral epicondyle of the humerus and inserts on the olecranon process of the ulna. The triceps brachii is a three-headed muscle with the long head originating on the infraglenoid tubercle of the scapula and the lateral and medial heads originating on the posterior shaft of the humerus. The heads come together distally to insert on the olecranon process of the ulna.
And I think we have this one to play here. Just double check.
Triceps brachii is the large extensor muscle located in the posterior compartment of the arm. It has three heads of origin: the long head, the lateral head, and the medial head. The origin of the long head is from the infraglenoid tubercle of the scapula. The origins of the lateral head are from the posterior and lateral surfaces of the superior one-half of the humerus. It is located both superiorly and laterally to the radial groove. The origins of the medial head are from the inferior two-thirds of the medial and posterior surfaces of the humerus and is located inferiorly to the radial groove. Together, the three heads insert onto the superior and posterior surfaces of the olecranon process of the ulna. Triceps brachii extends the forearm at the elbow. It is innervated by the radial nerve.
And off we go. Okay, here we see sort of the compartments inside the arm at the elbow. If you slice into an arm like this and peek down inside, you see the anterior compartment, the posterior compartment, and the medial compartment, and you can see where these various muscles are. This would be the anterior compartment having the biceps in it. That middle compartment has got brachialis in it. That's our prime mover. And the posterior compartment back here has got the triceps. You know what? Let's go ahead and take a peek at what video they've got on here. I'm not sure what they're showing us, but we'll see.
Although the biceps brachii is by far the largest of the forearm flexors, the brachialis generates about 50% more power and is therefore the prime mover of elbow flexion, with the brachioradialis and the biceps brachii acting as synergists. The prime mover of elbow extension is the triceps brachii muscle.
And here's a nice little table summarizing the muscles moving the elbow. So take a peek at those. Pardon?
It says on there that the biceps brachii.
Wow, it does. That's weird. I think I would disagree. That's actually a synergist. Brachialis is the prime mover. Okay. We're going to focus now on muscles of the wrist, hand, and fingers. The anterior muscles are flexors. The posterior muscles are extensors. And for this, you can take a look at your own arm in this really interesting way. We get the camera over here, and what I would ask you to do is to grab hold of your own arm. And that's weird to picture me grabbing. You guys don't see what I'm seeing. I've got my own camera here, and I'm seeing me grabbing my arm and grabbing my arm in the background. It's kind of a freaky shot to look at. Okay, grab your own arm and then make a fist with the one that that is being grabbed. And what I want you to feel is, where do the muscles tighten up? Here on the front of your arm or on the back of your arm? As you make a tight fist, this area is tightening up. These muscles are flexors. Now, what I want you to do next, keep a hold on here. In fact, flip your arm upside down and violently straighten your fingers. What tightens now? Back here. You feel it? These are extensors. These are flexors. And a lot of times the name includes the word flexor or extensor. So you'll see names like flexor carpi ulnaris, which flexes the wrist over on the ulnar side. So there we have a whole group of muscles in the forearm that are involved. And the point here is, most of the muscles that move your fingers around are not in your hand at all. They're in your forearm. So here we see a video on muscles moving the wrist and fingers.
Movement of the fingers and wrist occur primarily through muscles that originate in the forearm but have insertion sites within the hand and wrist. This design allows the hand to maintain fine motor control and strength without the interference of the bulky muscles. The forearm muscles can be divided into anterior flexors and posterior extensors, each with a superficial and a deep muscle layer.
Okay, so we're going to take a look at some muscles that do pronation, supination of the arm, and we'll start that here. What in the world? Whoa. And apparently that video is not linked in. That's okay. It's a summary video that we're going to see the details, and you're hearing a lot of this. We're doing some serious repeating along the way. We'll take a peek here.
The pronator quadratus muscle originates on the distal ulna and inserts on the distal radius. The two-headed pronator teres muscle originates on the medial epicondyle of the humerus and the coronoid process of the ulna, with fibers converging distally to insert on the mid-lateral surface of the radius. Contraction of these two muscles results in forearm pronation. Forearm supination is caused by the supinator muscle. The supinator muscle of the forearm originates on the lateral epicondyle of the humerus and the supinator crest of the ulna near the radial notch, and inserts on the proximal 1/3 of the radius. Supination of the forearm is assisted by the biceps brachii muscle.
Whoa, get back there.
Pronator teres has two heads, the humeral head and the ulnar head. The origin of the humeral head is directly superior to the medial epicondyle of the humerus. The origin of the ulnar head is from the medial side of the coronoid process of the ulna. The insertion is to the mid-lateral surface of the radius. Pronator teres pronates the forearm such that the palm turns posterior. It also assists in flexion of the forearm at the elbow. It is innervated by the median nerve.
I'll remind you as I start this last video that the list in your lab book really does mark the major muscles you'll be responsible for. There's some in these videos that are not in that list, and if that's the case, don't spend a lot of time looking at them. You might see a random question that accidentally asks about one of them, but I'll way more focus on the muscles that are listed in your lab book. The videos are really helpful to find those, and I would just kind of remind you of that.
The origins of supinator are from the lateral epicondyle of the humerus, the radial collateral ligament, the annular ligament, and the supinator crest of the ulna. Fibers run inferiorly and laterally to insert onto the superior 1/3 of the lateral surface of the radius, including adjacent anterior and posterior surfaces. Supinator supinates the forearm such that the palm turns anterior. It is innervated by the radial nerve.
And next page. All right, here we're going to take a look at the flexor muscles. Again, these are going to be on the anterior surface of your arm as you're standing in an anatomical position. They're the ones that curl your fingers closed. We got flexor carpi radialis, palmaris longus, flexor carpi ulnaris, which I mentioned a little bit ago. And again, as you look at these words, something like that first one up there, flexor carpi radialis. What's its motion going to be? Flexing. Flexing what? Your wrist bones. And it's on the side of the arm by the radius. It tells you where to look for it. So a lot of these names are very descriptive. And oddly enough, I'm going to leave you to look at the arms by yourself and find the bulk of these. The graphics in your book help enormously. The graphics in your coloring book are helpful. And I kind of want you to literally prowl through those arm muscles and find a lot of these. Take a look at this video.
All of the tendons of the long flexor muscles are held in place at the wrist.
Oh, there's a surprise in this video. If you've heard of people having carpal tunnel syndrome issues and wondered what in the hell a carpal tunnel is, you're about to learn it. Where'd my sound go? That was weird.
All of the tendons of the long flexor muscles are held in place at the wrist.
Flexor pollicis longus, flexor digitorum superficialis. There may not be any sound
By
here.
a thickening of the deep fascia called the flexor retinaculum. Consequently, this creates a tight space through which the tendons must pass prior to reaching their sites of insertion called the carpal tunnel. To allow for movement within the carpal tunnel, each tendon is enclosed in a sheath that enables it to slide back and forth. Still, this region is very susceptible to painful inflammation called carpal tunnel syndrome.
You know, we had that goofy little tubular liquid-filled toy in here. That is one of those tendon sheaths. And actually, this retinaculum you're talking about shows up really, really nicely on the arm. See this little band, this little white band of tissue right here beneath the palm of the hand? That's that retinaculum, that band of connective tissue that we're talking about that anchors all of these individual tendons that kind of run through here. And you can see those tendons here on the palm side of that retinaculum. So those are the tendons that get inflamed in carpal tunnel syndrome. And back to the presentation we go. Here are some of those muscles. We've got flexor pollicis longus, which is the band of muscle that is deep to these more superficial ones. By the way, the word pollicis means thumb. I think we've talked about that before. We see this muscle, which is the brachioradialis. This muscle right here and its associated tendon, which is the flexor carpi radialis. It's on the radial side of the arm. Remember, the radial side is the thumb side. This band here, which I'll color in blue, on the extreme opposite side with its tendon, is the flexor carpi ulnaris. Between those two, the middle one, which I'm not coloring in, between the blue and the red, that's the palmaris longus. So flexor carpi radialis is flexor. So is it going to be on the palm side or the back side of the hand? It's a flexor. It's on the palm side. If it's ulnaris, it's down by the little finger. If it's radialis, it's over by the thumb side. So a lot of the names will help you find these, which is one of the reasons I'm not going to kind of hand show you each of these. I want you to use a little bit of thought as you look at them. We have several videos to look at in this area, so let's start.
The superficial anterior flexor muscles are the flexor digitorum superficialis, the flexor carpi ulnaris, the palmaris longus, and the flexor carpi radialis. The flexor digitorum superficialis originates on the medial epicondyle of the humerus, the coronoid process of the ulna, and the shaft of the radius, and branches to insert on middle phalanges 2 through 5. The flexor carpi ulnaris originates on the medial epicondyle of the humerus and the posterior border of the ulna, and inserts on the pisiform and hamate bones and the base of metacarpal 5. The palmaris longus originates on the medial epicondyle of the humerus and inserts on the palmar aponeurosis. The flexor carpi radialis originates on the medial epicondyle of the humerus and inserts at the bases of the second and third metacarpals.
And that's it for that video. Now, one at a time, we're going to look at flexor carpi radialis, then ulnaris, and then superficialis.
Flexor carpi radialis is one of the superficial flexor muscles occupying the anterior compartment of the forearm. The origin of flexor carpi radialis is from the common flexor tendon of the medial epicondyle of the humerus. The insertions are to the base of metacarpal 2 and by a tendinous slip to the base of metacarpal 3. Flexor carpi radialis flexes and abducts the wrist. It is innervated by the median nerve. Flexor carpi ulnaris is one of the superficial flexor muscles occupying the anterior compartment of the forearm. Flexor carpi ulnaris has two heads, the humeral head and the ulnar head. The origin of the humeral head is from the common flexor tendon of the medial epicondyle of the humerus. The origin of the ulnar head is by an aponeurosis from the proximal 2/3 of the posterior ulna. The insertion is to the pisiform bone and by ligaments to the hamate bone and metacarpal 5. Flexor carpi ulnaris flexes and adducts the wrist. It is innervated by the ulnar nerve.
All right, I'll be a little bit nice. I was telling you that I'm not going to show you these, but I will show you this one to kind of give you a feel for how you would find them. As we look at the little arm and look at the little finger side of it, I'm going to rotate it so you're seeing the posterior view, and here is that flexor carpi ulnaris. It's attaching on the back of the elbow and running down the ulna to the base of the little finger. So there you have flexor carpi ulnaris. Way over here would be flexor carpi radialis. And with that little bit of orientation, I am going to let you try to begin to find a lot of these sort of on your own, if you will, or frankly, even if you won't. Let's now look at flexor digitorum superficialis. By the way, flexor carpi something something is flexing the wrist. What is flexor digitorum flexing? Fingers.
The origin of flexor digitorum longus is from the posterior surface of the tibial shaft.
What the heck? They got the wrong video here. Never mind. We'll get that one on next week. That was kind of that's just strange. And here's some pictures of some of these we were taking a look at now. Let me go ahead and jump to some videos for, you know what, hey, we are at about break time. We are recording, so do me a favor and kill the talking in the room and maybe the bouncing of the tough words. Okay, here we go.
The deep anterior flexor muscles of the wrist and hand are the flexor digitorum profundus and the flexor pollicis longus. The flexor digitorum profundus originates on the proximal 3/4 of the ulna. The insertion is on the distal phalanges 2 through 5. The flexor pollicis longus originates on the anterior surface of the radius and the interosseous membrane. The interosseous membrane is a sheet of fibrous tissue that holds the shafts of the ulna and the radius together. The insertion is on the distal phalanx of the thumb.
And now, we're going to take a look over the next few pages at some extensors that straighten your fingers back out. We've got interesting names like extensor carpi radialis longus and extensor carpi radialis brevis. Any guesses what the difference between longus and brevis are? Longus is long, brevis is brief or short. Extensor digitorum, extensor carpi ulnaris, extensor pollicis, brevis and longus. Pollicis, by the way, I've said it before, I'll say it again, is the thumb. Indicis would be, any guesses? Index finger, yeah. And then we have an abductor here. Get that timer out of the way. I hate that thing. So let's take a look at some extensors. And here we see some nice pictures. Again, these are going to be on the posterior surface of the arm, the kind of hairy back part of your arm, not the palm of your hand, if you will. And we can see a lot of the muscles that I was just mentioning. Let's look at some of these in videos.
The superficial posterior extensors are the extensor carpi radialis longus, the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, and the extensor carpi ulnaris. The extensor carpi radialis longus originates on the lateral supracondylar ridge of the humerus and inserts at the base of metacarpal 2. The extensor carpi radialis brevis originates on the lateral epicondyle of the humerus and inserts at the base of metacarpal 3. The extensor digitorum originates on the lateral epicondyle of the humerus and branches to form 4 tendons that insert on the dorsal surfaces of phalanges 2 through 5. These tendons can easily be seen on the back of the hand when the fingers are extended. The extensor digiti minimi originates on the lateral epicondyle of the humerus and inserts on the middle and distal regions of phalanx 5. The extensor carpi ulnaris originates on the lateral epicondyle of the humerus and the ulna and inserts at the base of metacarpal 5.
Extensor carpi radialis longus is one of the superficial extensor muscles occupying the posterior compartment of the forearm. The origin of extensor carpi radialis longus is from the distal 1/3 of the lateral supracondylar ridge of the humerus. Its long tendon passes under the extensor retinaculum of the wrist and inserts onto the dorsal surface of the base of metacarpal 2. Extensor carpi radialis longus extends and abducts the wrist. It is innervated by the radial nerve. Extensor carpi radialis brevis is one of the superficial extensor muscles occupying the posterior compartment of the forearm. The origin of extensor...
Here's a tip. The ones that are superficial are going to be much easier to find on the arm model, which means they're much more likely for me to ask. So even as you're going down the list of muscles in the lab book, if it's a superficial muscle, it's easier to see on most of these models. If it's deeper, often harder, and therefore no guarantees, but often less likely I'm going to ask it.
Carpi radialis brevis is from the common extensor tendon on the anterior surface of the lateral epicondyle of the humerus. Its tendon passes under the extensor retinaculum of the wrist and inserts onto the dorsal surface of the base of metacarpal 3. Extensor carpi radialis brevis extends and assists in abduction of the wrist. It is innervated by the...
Don't care.
Extensor digitorum is one of the superficial extensor muscles occupying the posterior compartment of the forearm. The origin of extensor digitorum is from the common extensor tendon on the anterior surface of the lateral epicondyle of the humerus, and the fibers divide distally to 4 tendons. These pass under the extensor retinaculum of the wrist to insert onto the extensor expansions on the dorsum of digits 2 through 5. Extensor digitorum extends all joints of digits 2 through 5, both metacarpophalangeal and interphalangeal. It also assists in wrist extension. It is innervated by the radial nerve.
I can kind of hear you as you sit and watch these. Why in the world is he playing all of these things that sound so much alike? And it's because the only way really to learn these muscles is to look at where they attach, what they do when they move, and in some cases what innervates them, although I'm not going to have you do that. And this is kind of my way of reminding you that this is the best way to learn these. Now, it helps also, of course, to get the arm model out, the coloring book out, and sit down and physically look at them. But if you're of the study type that does good with study cards, this is an ideal topic to just make flashcards and talk to each other about. Or there's some apps that do that really well.
Extensor carpi ulnaris is one of the superficial extensor muscles occupying the posterior compartment of the forearm. The origin of extensor carpi ulnaris is from the common extensor tendon on the anterior surface of the lateral epicondyle of the humerus. Its tendon passes under the extensor retinaculum of the wrist and inserts onto the base of metacarpal 5. Extensor carpi ulnaris extends and adducts the wrist. It is innervated.
And, man, what is going on with this thing? Okay, integrity people, ignore the jump. Here we see a lot of the extensor muscles that are deeper in the forearm. Let's take a look at some of these deeper muscles now.
The deep posterior extensors of the wrist and fingers are specific for the thumb and index finger. These muscles are the abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis. The abductor pollicis longus originates on the radius and ulna and the interosseous membrane and inserts on the first metacarpal and base of the thumb. The extensor pollicis brevis originates on the radius and interosseous membrane and inserts on the proximal phalanx of the thumb. The extensor pollicis longus originates on the ulna and interosseous membrane and inserts on the distal phalanx of the thumb. The extensor indicis originates on the ulna and interosseous membrane and inserts on the middle and distal phalanges of the index finger.
I don't know if you're watching me up here besides watching the screen, but another way to learn these is to literally make these motions yourself. Extend your thumb, abduct, adduct, and feel what's moving around inside your wrist, and it helps you to figure out where in the world these things are. If I abduct my thumb, I can literally watch my forearm and see what part's wiggling around. So that trick is also, if you've not played with that, really, really handy. 2 videos on this screen deal with flexion, extension, abduction, and adduction. Let's watch these.
The prime movers of wrist flexion are the flexor carpi radialis, the flexor carpi ulnaris, and the flexor digitorum superficialis. The synergists of wrist flexion are the palmaris longus and the flexor pollicis longus. Finger flexion occurs through the combined actions of the flexor digitorum profundus, the flexor pollicis longus, and the flexor digitorum superficialis. The prime mover of wrist extension is the extensor digitorum, with the extensor carpi radialis longus, the extensor carpi radialis brevis, and the extensor carpi ulnaris acting as synergists. Extension of the fingers occurs through the combined actions of the extensor pollicis longus, the extensor pollicis brevis, the extensor indicis, and the extensor digitorum.
And abduct, adduct for wrist and fingers.
As the names of the muscles imply, their primary actions on the wrist and fingers are flexion and extension, but also include abduction and adduction of the wrist. Wrist abduction occurs through four muscles: the flexor carpi radialis, the abductor pollicis longus, the extensor carpi radialis brevis, and the extensor carpi radialis longus.
Quick reminder, to abduct is to move away from the torso. There it went. Exactly.
Wrist adduction is induced through the extensor carpi ulnaris and the flexor carpi ulnaris.
Adduct, move back in, or add it back in toward the torso. And here we see a slice through the arm showing the medial, anterior, and posterior compartments. Again, just another view of these same muscles. And again, a really nice table that goes through muscles that act on moving around the wrist and the hand. There are a last group of muscles we need to take a look at, and these are referred to as intrinsic muscles. Not all of the muscles that move the hand around are in the forearm. The intrinsic ones are actually a part of the hand itself. Because if you feel around on your hand, it's kind of meaty itself. These are small muscles. They're typically fairly weak, and they lay entirely in the palm of the hand. And they give you really, really fine control over metacarpals and fingers. And the action of threading a needle is a great example. If you've ever held a needle still in your left hand and moved your fingers really, really subtly with your right hand, that's done with these intrinsic muscles. They abduct, adduct the fingers, and give a little bit of motion of opposition to move the thumb toward the little finger. Finger and thumb movements include flexion and extension. And as you read here, you can see that the thumb, when it flexes, bends medially across the palm. The fingers bend anteriorly, kind of closing into a fist. And extension does the opposite of that. So three groups of muscles we'll take a look at that include these intrinsics. There's the thenar eminence. This is the little ball of tissue at the base of your thumb. So if you look at your own hand on the palm side, that swelling at the bottom of your thumb, that's the thenar eminence. On the other side of the palm, the hypothenar instance is the meaty lump of tissue at the bottom of the little finger. So what the heck? Let's go to the camera real quick and look at thenar and hypothenar eminence, because we can, so why not? First of all, I can't find the freaking screen. Okay. Looking at my own hand with the camera here, the thenar eminence is here. Hypothenar eminence is over here. So those are easy to spot whenever you just know that you're looking for that fleshy bit or this fleshy bit. Thenar, hypothenar. Mid-palmar muscles. I love the name. They're in the middle of the palm, and this includes the lumbricalis, the palmar, the dorsal interossei. They're on the dorsal surface, and they are between the bones, and the name kind of tells you that. And you can see the detail of the first superficial layer of the muscles here, including a lot of these interossei muscles. Here is the opponens pollicis, which is going to be out on the side and will oppose the thumb. The abductor brevis for the pollicis, which is right here, and it would abduct or widen the thumb away from the palm. Here on the deeper layers, you can see some of these that are called the interossei, and you can see kind of why they're called this. They're down between the bones of the fingers on the dorsal surface of the hand, so dorsal interossei. Opponens digiti minimi is going to help to oppose or curl in the little finger, digiti minimi, little finger. And I will tell you honestly, I don't do a whole lot of picky lab practical questions inside the hand because it does get a little bit tight, although I may add in some on the thumb because I think we do have some of the thumb muscles that turn up really, really well. Really, really deep. With everything else stripped away, we see these palmar interossei muscles. They're part of the palm of the hand and down between the bones of the metacarpals. Dorsal surface, sort of the same kind of thing. These are on the dorsal surface of the hand, the back of your hand, the hairy bit, and we can see the between the bones muscles there as well, which is what the name interossei means, of course. Rotatable hand. is a nice little model. We do not happen to have this exact model in the lab, but we've got similar ones with our arm models, and you can see some of the muscles that are intrinsic to the hand here in this particular model, and frankly on our arm models as well. And that gets us to the end of Part C, and my suggestion is at this point you guys spend a little time in the lab. If you are sitting in the class watching this video with Dr. Burnside, this is the place for you and Dr. Burnside to go to the lab. Thank you, folks. I'm going to stop the recording now, and I suggest heading off to the lab.